Okay, so good afternoon, good evening, good morning. I'm Tim Hackett. I'll be your instructor for lower extremity sports massage. This is Kristen, my model. She is a runner, and we are going to start with anatomy and physiology, origins, insertions, actions of the major muscles of the glutes and the hip posterior. And then we'll go through some sports techniques with them in mind. Bony landmarks. The big ridge is the iliac crest. This big bump out here is the greater trochanter. When we get into hamstrings, you're going to want to know that. That's the ischial tuberosity and the sacrum. Okay? That's everything, almost everything we're going to need to know for this area. Starting superficially, glute max attaches onto the ilium or the iliac crest. Some textbooks refer to this as the lumbar fascia. It's the bottom portion of the thoracolumbar aponeurosis. And on the tailbone, glute max comes across like this, but it doesn't attach on the greater trochanter like medius and minimus does. It attaches just below it to the gluteal fossa of the femur, but the majority of it attaches into the iliotibial band, which is, if you look at any anatomy chart, muscles are red, tendons are white. This is a big sheath of tendinous-like substance that provides a great deal of support, structure, and stability for the hip and the leg. So glute max comes across like this. Origin, insertion. If you want to know what a muscle does, you contract or move the insertion back towards the origin, and that means it's going to do extension of the hip, and this is actually lateral rotation of the hip because it's making the hip rotate laterally even though her leg is rotating medially. Okay, so this is medial rotation of the leg, but it's lateral rotation of the hip. Okay, medius, right below, starts up in here, ilium, the bottom part of the iliac crest, deep to the glute max, and attaches down on the greater trochanter. Its primary function is abduction. So remember, this is abduction. This is a deduction. That's what later on we'll talk about the adductors. They do that. Medius and minimus do abduction, and they also internally rotate because of the angle. Okay? Minimus, deep to max and medius, so it attaches on the gluteal fossa of the ilium and attaches on the greater trochanter. It does abduction of the hip and external rotation. Okay, so you want to see what that muscle does. I'm going to ask her to hold her leg right here. Hold. Good. Relax. And then the other deep one is piriformis. Piriformis laterally rotates the thigh. So that's going to be like that. That's internal rotation, external rotation, or lateral rotation of the thigh. Begins right here on the tailbone and inserts onto the greater trochanter. Piriformis is often the cause, or a tight piriformis is often the cause of sciatica or sciatic-like symptoms. So if you have a client that's got pain shooting down their leg, piriformis is usually where you want to start. And if there's a trigger point there, or if the muscle is tight and it's pinching because the sciatic nerve comes out of the sacrum like this, it comes out of the sciatic notch and comes down like that. So if piriformis is tight, it pinches the sciatic nerve right here, and it sends the pain pattern sometimes all the way down to the foot, depending on how severe the pinch is, or how severe the trigger point patterns will be slightly different. Basic movements. You want to know what these muscles do and how to treat them, in addition to what you do with an athlete client who has low back pain, hip pain, knee pain, radiating pain, numbness, tingling, any of those things. This is probably where I would start. Let's just see. We're going to do range of motion testing. So this, and I would never work this way on a client because this is not great body mechanics for me, but I'm doing this so that I'm not blocking the camera. So passive range of motion for glute max. I'm going to lift her leg until I get a pain or some sort of response from her that she's uncomfortable. I heard nothing, felt nothing, you noticed nothing twitched or jumped, so that didn't bother her. Now I'm going to ask her to do that on her own. I'm just going to hold her foot, and I'm going to ask her to put her foot on the ceiling and relax. Okay, did that hurt?
No, it was just hard.
Okay. So the response to active range of motion was it was hard. That means I really want to explore that, but that's not going to happen in this video. Manual resistive motion. Hold right there and keep resisting me, but relax slowly. Okay, relax. That's manual resistive testing. What it tells me is, can she find that muscle through a farther, larger range of motion or not? And if she can't, then we need to figure out why she can't find that glute muscle. Sequences. Well, let's do all of them. So, medius. Medius, minimus, and piriformis. They do rotation. Minimus and medius do abduction. So I'm just going to run through all of those. And what I do is I just kind of push my hand in. So now I'm in medius and minimus is right below it. And I'm just going to rotate her and see if anything pops up, or if I get any kind of a pain response from her. And so far, no. Okay, hold that for me right there. Good, relax. Hold right here and relax. Good. So there's a little bit more going on in piriformis than medius or minimus. So there's some additional stuff that I would do in there involving muscle testing, but that's outside the scope of this class. So sports sequence. I don't know if the camera picked it up or not, but when I did that, she kind of sighed deeply. Was that a good sigh or a bad sigh?
That was a bad sigh.
A bad sigh. Okay, what's happening?
It's tight.
Just tight, no referral?
No.
Okay, so that's all I did was palpate this, right? So the butt of my hand is right on the lateral edge of her sacrum. That's all I was doing, was just seeing what was happening. And she gave me a sign that that wasn't all that comfortable for her. So this is a terrific example of a very simple response. It's not a great deal of pain, but it's sore and it's tight. Okay? So I'm just going to hold that pressure. I'm going to move her leg around until it releases. Give me a number on a scale of 1 to 10, Kristen.
Like 2, 3.
Okay, good. So her pain level is only between 2 and 3. So that tells me I've got a lot more room to move around in. I personally never go above 5 on a scale of 1 to 10. The Travell books used to talk about 7 out of 10. I think that's ridiculous. If a person is at a 7 on a scale of 1 to 10, there is no way in the world that muscle is going to relax and allow you to do what you need to do to get it to function better. I do not think I help anybody by putting them in pain. So again, I'm just going to internally and externally rotate. You can either continue with your hand. Big muscles like glutes, I prefer to use my elbows just because that's a big muscle, and I'm sure as hell not going to use my thumb or my fingers in anybody's glutes. So a little passive range of motion with my elbow in the spot that she said was sore. A little more rotation, a little abduction, a deduction. If this is a pre-event sports massage, everything is different. It's quick and light. We're just going to get blood flowing to move. The athlete is about to perform, whether it's a run or a swim or a bike or baseball, football, whatever the sport is that this person's about to compete in. We're just going to help loosen them up. Nothing deep. You don't want to cause any trauma. You don't want to cause any inflammation. You just want to get blood flowing. So it's quick, fairly light petrissage, effleurage, stretching. Okay? Those are the major components of glute max, medius, minimus, and piriformis.